Hello everyone, today's video is just a compilation of thoughts that I've had recently about COVID-19 and some updates with statistics and recommendations and opinions. And as always, you guys know my goal for this video series really is just to provide some education and some reassurance and touch base with you about things that I've heard that are happening. So the latest statistics are, and you know everything in my world is more from a pediatric standpoint, but 40,000 children have lost a parent from COVID-19. So that's a huge impact on children, even though obviously statistically pediatrics population don't have nearly as high of a risk of death from COVID-19 as adults do. However, there have been 280 deaths in children from coronavirus, and that's really sobering, I think. Now, the U.S. death toll is continuing to rise. It's now around 566,000, the latest data that I checked. And that's really staggering when you think about how many people it's affected over this past year. Now, those numbers are hard to hear and truly tragic, but I do think a lot of us in healthcare are feeling some hope now thanks to the vaccines, and I wanted to do some updates on that as well. I've been blessed to help out with the recent vaccine clinics for mass vaccinations, which these things are just so exciting. If you've never had the opportunity to volunteer at one of those, when you see hundreds and hundreds and hundreds, sometimes thousands of people come through this vaccine clinic to get their dose of hope, to get their boost of immunity, to stimulate their body to make antibodies against the spike protein on the cell wall of the coronavirus. It is so exciting to see this happen. And I know in ours, we would play music and we would dance and still get a lot done and keep things moving. And it was truly a blessing to get to participate in those. So at least for my local, I'm in rural North Carolina, our local healthcare systems, the hospital base is slowing down a bit with providing these mass clinics, but is now transitioning over to providing vaccines through your individual provider office. So this is a little bit of a change in process. And a part of the reason is that they had just done such a good job getting the vaccine out there. Towards the end of some of these clinics, we were down to all available age groups could receive the vaccine, and still we had some slow times. Not very slow, but some that slowed down. And so what we're running into now with vaccine clinics is not a lack of supply. The vaccine had been available, and not restrictions keeping folks out who weren't allowed to receive the vaccine, but just folks not coming in for whatever reason. Now, it may have been logistical. Maybe they couldn't get off of work that day. Who knows? That's entirely possible. But part of it, at least, has been vaccine hesitancy. And this is something we worry a lot about, particularly among healthcare workers themselves who are at higher risk from being exposed because, of course, of their patient population. So I just hope that if you guys know me, you know that I like science and I like believing actual data and actual facts. And probably the most aggravating thing in the world to me is misinformation. And for some reason, the internet is packed with it. And the stuff that's the most absurd seems to get the most press time, and that drives me nuts. So let's just do a quick recap. Feel free to see some of my older COVID vaccine videos, but remember that things change rapidly. So some of the stuff I may have said then could have been the best we knew then, and now we know more. So still we have the Pfizer vaccine available, goes down to age 16. 2 doses required, recommended 21 days between doses, a messenger RNA technology, which is not new technology, which does not change your DNA. The messenger RNA just gets through the cell wall because it's wrapped in a phospholipid. So it gets through that phospholipid bilayer thanks to its lipid gift wrapping, and then it helps your body create protein. The protein is the same as the spike protein on the cell wall of the coronavirus itself, so that the cell then presents the protein to your immune system, and your immune system starts cranking out some antibodies. It never gets through to your nucleus where your DNA lives, okay? So let's make sure you're not getting that mixed up. Same for the messenger RNA technology in the Moderna vaccine, which is also a 2-dose series, spaced about 28 days apart. Many people have more of a reaction to the second dose than the first because they should, because their immune system is already aware of this spike protein. It sees it again and it goes a little bit crazier that second time. So you may have some fever and chills and fatigue and joint aches and things like that. And that's a completely normal response to your immune system really getting down to business, and that's a good thing. Slightly later to the market was the JNJ product, and it is a different technology. It's more of the traditional technology with an adjuvant added to help the immunogenicity of the vaccine. Now, very recently, you know, the FDA has put a pause on the JNJ vaccine, so let's touch on that briefly too. It was because there were 6 cases of cavernous venous sinus thrombosis, a rare clot disorder, and of the 6 cases, all were female, and 1 actually passed away, which is really tragic. Now, the problem is, I think there were 7.8 million doses administered of this vaccine, so we're looking at less than 1 in a million. You know, there were 6 cases out of almost 8 million doses administered. So the question is that even enough above the baseline incidence in the normal population to even begin thinking about causation? And always remember, please, there's a huge difference between correlation and causation. This is one of the trickiest things to understand in statistics and medical research. So just to help my children understand this idea, I'll always say, everybody who eats carrots dies. And that is the truth. That's absolutely true. But it's because everybody dies eventually. It doesn't mean the carrots cause their death. Hello. So I think it's very important for everyone to remember that. In fact, that was part of the problem we got into when there was the absolutely fraudulent proposal that MMR caused autism when it absolutely did not, and has been disproven to death since then. But when Andrew Wakefield, in his fraudulent attention-seeking data created paper in the British journal Lancet claimed that causation, that's when everybody went crazy, because we do administer the MMR vaccine around 12 months, and autism is typically diagnosed around 18 months to 2 years. So it's easy to say, look, this happened and then that happened. But the correlation, the timing, does not prove causation. And like I said, it was disproven later. So it could be one of those cases with this. We don't know yet. I hope people who are vaccine hesitant actually take this as a reassurance. Things are being monitored. Data is being kept and analyzed. And the authorities, the experts, are doing everything possible to hold back anything that's not safe and to analyze it until they're 100% certain that it is safe and that this is not a causal relationship between that vaccine and these incidents of the cavernous venous sinus thrombosis. So I want you to trust the process. If you wanted to ask me personal questions, would you let your own children get it? Obviously, absolutely, yes. Very excited to administer my daughter, who's a 3rd grade teacher, her first dose of the COVID vaccine, and we even made the local news. That was fun, our little 15 minutes of fame. And then eventually, as the categories opened up, then I also, my 19-year-old son, 17-year-old daughter, 16-year-old daughter, they also got theirs. Now, I also have a 15-year-old, and she wasn't quite old enough yet. Good news on that front too. There's already a study released from Pfizer on their product for 12 to 15-year-olds. So hopefully soon we'll be able to bring down the age group eligible to receive vaccine down to age 12. And there are already studies from Moderna for even younger than that. So ultimately we hope to get everyone protected. But I do think, even as a pediatrician, and I only want to advocate for kids in general, but I do think it was appropriate how it was done, because children didn't have the highest risk for death from COVID as did the older adults, so it makes sense that they developed the vaccine for them first. So I hope this has been some good information. Yes, I trust the vaccines. No, there are not chopped up babies in the vaccines. Guys, if you are seeing stuff and it sounds really horrible and it sounds really legitimate, it might not be true. I need you to question your sources, okay? Yes, there are fetal cell lines that are used in almost every single kind of medical research. They were patented back in 1972. They came from 2 fetuses, not from the United States, from Norway or Switzerland. It was not here. But those babies were not aborted intentionally to be used for medical research. They were aborted anyway, and then someone used them. And those cell lines are able to be propagated indefinitely and have been. That was 2 babies in the 60s, no more. And even the Pope himself has said, if we are truly pro-life, we would want vaccines that save people and keep them alive. Another argument I've heard lately that's frustrating is that, what good is it to get the vaccine because you still have to wear your mask? Okay, first of all, you sound like a whiny baby because your mask is to protect others from your respiratory droplets. So that is your act of kindness and charity and goodness and goodwill to all those around you that you could accidentally kill with your big fat respiratory droplets. But the reason is because we can't trust that everyone around us has had their vaccine. We want to set a good example. Even the vaccines for adults, efficacy is excellent at 95%, but there's always going to be the 5% risk. And rules are changing. If you're in a small group now with everyone who all the people in your group have also received their vaccine, you may take your mask off. So we've already had some family get-togethers since everyone that we invited over has been vaccinated. So it is changing. It is helping. It is protecting people. It's incredible and it's encouraging. The scary part right now are these different variants that are popping up. And so it's almost this, you can visualize this battle of good and evil as people get protected from the vaccine just in time before they come up against this more virulent or more contagious variant that could even infect younger people. That's why it's so important that we get these vaccines developed and studied in time to give to the younger people before these variants should arrive. They're already here, but so there is an ongoing battle, and it is very helpful for the society at large. The more people that get vaccinated, the fewer people can be a reservoir for the virus to be able to develop these different strains that could be more contagious and more dangerous. So I would highly encourage everyone to get your vaccine. And if you're saying, wait, do you mean me and my children? Yes, I do. Because a lot of times after these videos, I get personal messages and they say, but you don't mean me, or you don't mean my daughter that's 17 or my son that's 18. Yes, I mean you. It's available. It's for, in the United States right now, it's for all 5 categories. Even in rural North Carolina, we've done a phenomenal job at rolling out this vaccine to all neighborhoods. We are still concerned about some racial and socioeconomic disparities, both in care and testing and vaccination, but some of those are because of some persistent vaccine hesitancy. It's not that we don't want to deliver the vaccine to everyone. So please, please, please get your vaccine. Your primary care physician is probably able to give it to you if you haven't received it in one of the mass vaccination clinics already. I would highly recommend you do that. The sooner you can get it, the sooner your body's going to start producing antibodies, the sooner you can get that second dose and then have complete and final protection 7 to 10 days after your second dose. That is really very exciting, and I think very hopeful for this time in the pandemic. So I hope those have been encouraging words. Sobering, there are still lots of pockets where the numbers are high and a lot of people are catching it. People are still being admitted to the hospital every day. People are still dying from COVID. Don't get so optimistic and hopeful that you think we're already finished with this, because we're not. But the vaccine is the way that we're going to get finished with this. So guys, please keep up your good habits forever, not just with the pandemic. Let's keep washing our hands, practicing social distancing, wearing your mask when you're around people who haven't been vaccinated. And please get your vaccines. We can all quit wearing these masks. Thank you so much.